We speak now to Howard Catton, Chief Executive Officer of the International Council of Nurses. A very good evening to you, and thank you so much for speaking to us, Mr. Catton. I was just reading, I think a few months ago, the WHO estimated that an additional 9 million nurses and midwives would be needed to achieve UHC by 2030. Is this a global problem, the shortage of nurses, or is the shortage more acute in certain regions than others?
Good evening to you, and happy International Nurses Day to you as well. Nurses around the world have been celebrating International Nurses Day. But as your reports made clear, the pandemic has taken a huge toll on the physical and mental health of nurses everywhere, and we are facing a very significant global shortage, 9 million, possibly even more, nurses who are burnt out, suffering from anxiety, psychological pressures, leaving the profession early. And that's why we need a very significant investment in nursing education, nursing jobs, and nursing leadership as well. And I have to say that the problem is more acute in lower and lower middle income countries as well. They often start from a much lower base with fewer nurses per head of population than high income countries. And of course, they've also been subject to recruitment from some of those countries as well. We won't have good health, we won't have access to healthcare without our nurses. They're the backbone, they're the foundation stone of our health systems worldwide, and that's why we need to invest in them.
So if we're saying that countries need more qualified and competent nurses to effectively address increasing health challenges, and we know the context there of changes as we see with COVID-19, and even across the globe, how countries have been afflicted by COVID-19, the modelling was somewhat broad, but it's been different from country to country and continent to continent. So how should this then be approached? Because we see often that certain countries are recruiting nurses from other countries, but as the globe contends with these different ailments that require more scientific knowledge, how should we approach that education and training?
I think the first thing to do is that countries should look at the health needs of their population and the demand that is going to be there for healthcare in their countries. You know, around the world, countries are facing ageing populations, more people with chronic and non-communicable diseases, bigger populations as well. Start from the basis of what your population health needs are, and then plan your workforce so that you're self-sufficient. Self-sufficiency is what we would argue for that countries should aim for in terms of the education of their workforce. And then don't think of education of nurses as a cost. Think of it as an investment in your population's health, your population's safety and security. I think at the moment what we're seeing is that the shortage of health workers is arguably the greatest threat that there is to global health. And we see that when health systems break down, it impacts on our economies, it impacts on our communities, impacts on the safety and security of the lives that we lead as well. So I think it requires a change in mindset about investment in health and investment in nursing. And it requires governments and countries everywhere to walk the talk. They've been great at the applause, at the warm words, at the plaudits for everything that nurses and health workers have done. And yes, they deserve that, but they deserve more than that. They deserve investment, they deserve protection of their rights, just like everybody else.
I mean, certainly the experience here in South Africa, we saw nurses, even though they were at the front line, lacking PPEs. In fact, there have been scandals of some of these PPEs being found dumped in rivers. So, as you say, it's about the investment if we're to build a resilient workforce. But we need to have transparent and realistic action in order to achieve that. What would be the litmus test for that? Because, you know, again, I go back to the fact that the context is different. Different health systems have different needs. So juxtapose the African continent, for instance, with the Northern Hemisphere.
But listen, you're absolutely right about the practical issues that were lacking at the start of this pandemic in many countries. Countries simply weren't prepared. They didn't have PPE, they didn't have sufficient oxygen or ventilators, they didn't have enough healthcare workers as well. So preparedness is a key and critical issue. I think that countries often are missing the advice of senior nurses in their decision making as well. You know, nurses, they absolutely know how to deliver health systems and what works well, and you should have them around the tables advising on policy design as well. They should be in the ears of the political leaders, advising them on the decisions to take that are specific to their countries as well, and stay close to people. The people of countries know what they need, know what they want. They always highly trust, in polls and surveys that are done around the world, the contribution of nurses as well. And I think that they have a really important role as well in terms of saying what sort of health services, what sort of health systems that they want to see for their countries too. Yes, we can always learn from other countries, but we shouldn't be trying to import or export our health problems. We should be looking at addressing the needs country by country and through investment and support for nurses in the healthcare workforce.
As we mentioned, in KwaZulu-Natal province, which is where we have experienced extreme inclement weather and floods, the nurses there were talking about working conditions. It's long hours, low pay. So I saw a tweet earlier on saying crime and compassion go hand in hand. So how do we create more comfortable environment for nursing staff? I understand that the nurses and midwives comprise more than half of the health sector workers. So that means we need to take care of them. How do we do that and stop calling them incompetent if they don't have at their disposal, a conducive environment?
You know, it's shocking, some of the evidence around the world. Not only the tragedy of more than 180,000 healthcare workers who have died globally as a result of contracting coronavirus. We have studies to show that the risks of assault and abuse in healthcare are 15, 16 times more than other sectors of the economy, that there's a greater risk of physical injury in healthcare than there is if you're working on a construction site. This is simply a failure to respect and to value nurses and other healthcare workers. But the steps that we need to take, a lot of these are really simple, practical steps. Make sure that nurses have the equipment that they need to do the job. Make sure there are enough of them. One of the biggest drivers of nurses who leave is where they feel burnt out and stretched because they know that they're not able to deliver care to the level, the quality that they've been educated to, because they're simply always short on every shift that they go on as well. So making sure that nurses have the same rights and the basic equipment and support at work is a key and fundamental. In some parts of the world, I've seen a renewed interest in nursing because of the pandemic. People have seen what a fantastic profession it is. If you want to make a difference to people's lives, then nursing has got to be up there as a profession to go into. But I've also heard nurses, potential nurses in other countries who said, I look at what's happened here and I've seen that nurses haven't had the support, haven't had the protection, still waiting for a vaccine, are very lowly paid as well. And actually it's had the exact opposite effect and driven people out of the profession. And we come back to this fundamental. None of us are going to have healthcare, accessible, safe, and quality healthcare if we don't have nurses. They're overwhelmingly the majority of our healthcare workforce delivering frontline care. And if they're not there, we've seen the pictures from around the world about what happens when people suffer without their healthcare services. All the burden will then fall onto families and friends as well.
Thank you so much for speaking to us. Howard Catton, Chief Executive Officer of the International Council of Nurses, speaking to us about the state of nurses on this International Nurses Day. Right.